HCPCS stands for the Healthcare Common Procedure System. This system was developed by CMS to identify services, products, or supplies that were not included with the CPT or current procedural terminology code set. It was required for Medicare claims as of 1983 and eventually has been adopted by all third-party payers. It does not include all the procedures and treatments that are in CPT, so CPT was formally adopted as part of the HCPCS code set as it pertains to claims for Medicare patients. In HCPCS, there are two references for levels. For HCPCS Level 1, when you hear that as a reference, they're commonly referred to as CPT, both the Category 1 and Category 2 CPT codes. And HCPCS Level 2 are commonly referred to as HCPCS of Level 2 codes. HCPCS updates are made quarterly, but new books referencing the entire code set are only published at the beginning of the year, effective January 1st. CMS has a request process for evaluating new code requests or updates and provides public meetings to discuss changes. Updates can include adding codes, revising descriptions, updating the indexing in the code books, or inactivating codes. For example, for the drug codes that are in HCPCS, a dosage may have changed and they will retire that code and add a code with the current dosage. All information is included in electronic files for HCPCS codes and can be found on the CMS HCPCS website. HCPCS is used for recording or identifying additional supplies that may be used in the outpatient setting or supplies provided to the patient to take home from a hospital or other provider setting. As with CPT, HCPCS codes must also be accompanied by an ICD-10 CM code to indicate medical necessity when submitting the claim. Many codes used specifically for Medicare beneficiaries, such as a cervical or prostatic cancer screening code, would be reporting using a HCPCS code rather than a CPT code, because HCPCS has created codes that are more specific for Medicare patients than what is currently in CPT. Selected codes are also used as part of performance measurement reporting for the outpatient setting. HCPCS is a 5-character alphanumeric code that begins with a letter. Similar categories of services are generally grouped together. For example, all ambulance services begin with an A. Most drugs administered in a healthcare setting begin with a J. Examples of subsections for HCPCS code include transportation services, such as ambulances, durable medical equipment codes, temporary procedures or professional service codes, orthotics and prosthetics are some examples of the codes that are in the HCPCS system. Some of the codes that you may see assigned in HCPCS, first one is an example of a drug code, the J code for an injection. You notice it will tell you the mode of administration, that is an injectable, the type of drug, acyclovir, and the dosage 5 milligrams. The next code is for a equipment, an enteral nutrition infusion pump. This one is without an alarm. A G code, the last 3 are G codes, and they're slightly different. So the first G code identifies the fact that the patient had an influenza virus vaccine administered. The next one is elder maltreatment screen documented as negative, no follow-up required. The last one, no documentation of an elder maltreatment screen, reason not given. These are 3 examples of ones that are used in performance measures as one of the indications for numerator or denominator exceptions when you're looking at some of the outpatient measures. HCPCS also has guidelines. There are no official guidelines, but they're rather instructions or advice that are listed in the code book under the code description that relate specifically to how to bill that code, or if there's exceptions to when you can use that code for billing purposes. HCPCS is currently not identified with social risk factors in the Siren compendium, but here are a few examples of the types of HCPCS code currently available that relate to some form of transportation status, a fact that the patient is getting home delivered meals, or that they had nutritional counseling through a dietitian visit.